Welcome to today's press briefing. We have on the stage two doctors with us. They are Dr. Zhang Shuoquan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Sarah Ho, Chief Manager of Hospital Authority. Dr. Zhang will first give you an update of the cases. Good afternoon. As of last night, we recorded 124 positive cases, case numbers ranging from 13401 to 13524. 31 of them are imported cases, including 21 patients arriving from India on a vessel. The vessel arrived in Hong Kong on the 23rd, and there are also 93 local cases. Among them, 53 are related cases. That means cases related to other cases, and they include family members of residents in Kwai Chung Estates, relatives, friends, visitors, and there are also other cases. There are 6 untraceable cases, and I'll give you the details in a moment. There are also 33 cases involving residents in Kwai Chung Estates, 15 in Yat Kwai. 1 is a security guard of Yat Kwai, 4 being residents of Ying Kwai, and 10 residents in 4 units of Ha Kwai, 1 in Yuk Kwai, 1 in Ya Kwai, and 1 in Choi Kwai. So together with preliminary positive cases, the number of cases in Kwai Chung State is 276, up by 64 from yesterday. Of course, many of these cases involve the same unit. So altogether, 30 plus more units are involved. There are 17 more units in Yat Kwai House and 15 in Ying Kwai and 1 unit in Nga Kwai. Altogether, 4 units in Nga Kwai have been infected, 5 units in Ha Kwai. For Chin Kwai, no new units. Yuk Kwai, 1 more unit totaling 2. Hill Kwai, no increase. Choi Kwai, 1 unit, so altogether 2 units involved. Luk Kwai, 1 unit. Big Kwai, 1 unit. Chun Kwai, 3 units, up by 2, and also Pak Kwai, 1 unit. So among yesterday's cases, well, in Phu Keung House, we took environmental samples. We took 11 of them, and 3 of them are found to be positive. And there are also positive samples found at the water taps, basins, and the drain outlets on the floor of the upstairs unit. Among the confirmed cases today, I'd like to highlight 1 case, and that is a resident living in Glory Court of Tsuen Wan Gardens. It's an untraceable case, and there is another untraceable case, 13340, living in the same building. These are residents living in Unit 5 on the upper floors of the building. We're concerned whether there could be vertical transmission in a building. So my colleagues and the experts are visiting the location at the moment. Yesterday we mentioned 13370, who is a hairdresser or somebody working in a hair salon in Feng Wong Sun Estate, Sun Fat Ying Salon. And we have a new case, 13481, who is a part-timer at the same salon. And we've also identified 13480, another new case, who went to this salon before. They may be linked, and these cases carry L452R. At the moment, the source of transmission is unknown, but these could be related cases. So may I appeal to members of the public that if you have recently been to this salon called Sun Ying Zhang, please contact us and get tested as soon as possible. Coming back to the 6 untraceable cases today, One lives in Tower 2 Grand Yoho. This case is an accountant in One Pacific in Kwun Tong Road. He arrived in Hong Kong on the 16th of January, and then when arriving in Hong Kong and whilst in Shanghai, both tests were negative. But on the 23rd, this case started to have a fever, and we believed that it's more likely that the case got infected in Hong Kong. The case is still under investigation. The other case is a 62-year-old male who is a driver at the clubhouse at the Gold Coast, and he lives in Fanang Kar Fook Estate for On House. Earlier, there was another case who is a cook at Gold Coast. They didn't know each other. There was no contact, but perhaps they shared the same toilet and the changing room, and we would invite the owner of the premises to cleanse and disinfect the place thoroughly, and those people involved would need to get tested as well. The other case is a 41-year-old female. As mentioned by the HA colleague, she works in the Lee Ka Sing building in a hospital. She lives in Oi Tung Estate in Shau Kei Wan. At the moment, this case remains untraceable. The other case is a 75-year-old male who lives in Tat Sin House of Wong Tai Sin Upper Estate. He's a retiree, and he also carries a L452R strain. At the moment, this is an untraceable case. Now, we notice that there is transmission in Wong Tai Sin, be it the hair salon or in Tropicana Gardens. As mentioned by our colleagues, there could be vertical transmission in Tropicana Gardens, and some patients have not been identified early enough. That means that there is now transmission in the community. So I appeal to residents in Wong Tai Sin to get tested and get as soon as possible. The last two untraceable cases. The first one is a 40-year-old male who works in Hang Seng Bank in Ho Man Tin. He lives in St. Martin Tower 1 of Pak Sek Kok, Phase 1 St. Martin. At the moment, this is an untraceable case. The other one is a 60-year-old male. He is a repairman for watches in Kam Sing Industrial Building in Washington Street. I'm sorry, this is not an untraceable case. And I'd like to report on a few matters.
The Home Affairs Department earlier has distributed rapid test kits to residents in certain districts, and they advised them to take tests on their own. We will remind members of the public, if you use such rapid tests and test positive, please go to the A&E department and seek medical attention as soon as possible. Apart from seeing the doctor, you should stay home as much as possible. You should avoid going out to avoid spreading the virus around in the community. The next thing is that at Lam Chin, Lam Kam Highway, from Khao Liu Ha to Ping Long Garden, the sewage samples collected tested negative for COVID-19. So we would narrow down the areas for sewage testing and would do further tests. So residents in the vicinity should take the tests, and we would set up mobile testing stations around the area to convenience the public. Right now, we have over 70 preliminary positive cases. That's all from me. Dr. Ho, can you update us on the HA's situation? Good afternoon. As of 9 a.m. today, in the past 24 hours, the HA has reported 120 confirmed cases, and 21 patients have been discharged in the past 24 hours. So far, 12,623 patients have been discharged, and 508 patients are hospitalized at North Lantau Hospital Infection Control Center, Hospital Authority Infectious Disease Center, AWE Community Treatment Facility, and 11 public hospitals. All the patients are in stable condition. Thank you. So Q&A session, please raise your hand. Please use the mic to ask a question. Please introduce your media organization. Well, the one on the left side on the third row, I'm from TVB. This morning, the chief executive said there would be a sort of seamless transition of Ha Kwai House from the RTD to a lockdown. So we saw that some residents have gone out this morning with the negative results. What happens? What is the problem? So who should be held responsible for that? And also for Yat Kwai House, more and more people have tested positive. Would you be extending the lockdown for a few more days other than the 2 days already imposed? And some residents complain about the cleanliness of the estate, and they are stressed because a lot of people are lining up for tests, and they can get easily infected. So can you improve the situation? And then I know that you are short-handed. So would you consider locking down the entire Kwai Chung estate to reduce the risks? I don't have the details about Ha Kwai House. Generally, we will have to be looking at the where the patients are living. Are they related to confirmed cases or what? So we'll take all these into consideration and forward the information to the relevant authorities to make a decision on whether the lockdown should be extended, because this is a major decision. As to whether we should extend the lockdown period, we will have to be looking at the developments. And residents have to take the test for 3 more times in the extended 2-day lockdown. So we'll see whether there are more cases detected or the case number is going down. The next one. The one at the back row, the lady there. From RTHK, I have a question on Yat Kwai House. In the past few days, there have been preliminary positive and positive cases, and the incubation period for Omicron is relatively short. And the Yat Kwai House has been locked down for 5 to 6 days. Have you made an estimation of the number of people who have been infected before the lockdown, or do you know whether the people were infected during the lockdown period? Now, the lockdown period is extended. Will people get infected easily as a result? And what is your assessment of the risk in Kwai Chung Estate? Do you think you should lock down the entire estate or extend the lockdown area? And some of those infected have not been vaccinated. And for this latest outbreak, how many people are in sort of serious condition? Omicron is highly transmissible, but then the symptoms are relatively mild. So is it, well, it won't be causing too much problems among the patients, right? And for the 276 confirmed cases, can you tell us whether it is for the entire Kwai Chung estate or what? Well, that number covers all the entire Kwai Chung estate. And for Yat Kwai House, the incubation period may be relatively short for Omicron, but for some patients, the incubation period may be longer. So we cannot make generalizations here. So the entire incubation period, if we want to cover everyone, should be 14 days. And maybe a lockdown for a few days may not cover the entire incubation period. But we'll be watching out the general trends and whether we can actually detect most of the cases during that lockdown period. For individual cases, they may be infected by patients and then detected at the quarantine center. So we might not be able to detect them early. Maybe such persons will only be identified at the quarantine center. As for the risk of Kwai Chung Estate, we are considering the situation of the various blocks there. We are watching closely whether the number has gone up or what. A lot of testing is going on in the area, and the residents are very cooperative, and they come forward for testing on a voluntary basis. And if there is indeed a major outbreak, we won't rule out any possibility. As for whether Omicron variant will only cause mild symptoms, we cannot say for sure. We've been seeing cases whereby the patients have been vaccinated, so it's difficult for us to tell. The mild symptoms is a result of the vaccination or is because the variant carries only mild symptoms. Now, a lot of the residents in Kwai Chung estates are elderly people, and they haven't been vaccinated, and a lot of young people have not been vaccinated either. Anyway, we are appealing to the public, please take the vaccines as soon as possible. I agree with what Dr. Chong said. For this latest wave of outbreak, only one patient is in serious condition, and he has been discharged already. He's recovered. Like what Dr. Chong said, at the Kwai Chung estate, there are relatively more elderly people, and they very often suffer from chronic diseases. So we are watching closely the situation, and some patients have not been vaccinated. So we appeal to those who haven't been vaccinated, please take the vaccines as soon as possible. And during the Lunar New Year holiday, please keep social distancing. The lady at the back row here.
I'm from Hong Kong 01. My first question is this. I heard that there are 4 confirmed cases in Yat Kwai House, which turned out to be false positive. Can you confirm that? And how will the arrangement be? Because I understand these confirmed cases have been sent to hospital. So for the test results being false positive, how will you deal with these residents? And for today's confirmed cases and preliminary positives, are there untraceable cases among them? Can you tell us the details of these cases? Who are involved? Third question, we see vertical transmission in Tsuen Wan. Many residents in Kwai Chung estate went to Tsuen Wan as well. So will Tsuen Wan be the next high-risk location? Will you be concerned about a major outbreak in Tsuen Wan? I'm sorry, let me supplement the information about one of the cases, and it's the 6th untraceable case. It's a 29-year-old female who lives in Kwai Yok Court on Kwai House. At the moment, we are trying to find the link. She started to exhibit fever on the 24th, and on the 23rd, she tested positive at the testing center. Judging from the 3rd and the 4th waves, we should not confine ourselves to a single building, be it a private or public housing estates. There could be vertical transmission of the virus, as we reported in the past. Of course, if you go out, you need to be vigilant. You need to make sure you're properly geared up and that you should observe hand hygiene, and you should avoid crowds, and you should avoid using common communal facilities, and make sure you wash your hands afterwards if you do use them. At home, you need to observe home hygiene and be careful about your drainage and pipes at home. If there are alterations, you should check for leaks and cracks, and you should make sure that you pour water into the U-traps. Anything to supplement relating to false positive cases in Yat Kwai House? I don't have details, but in general, the laboratory under the Center for Health Protection would check these cases again, because for cases with high CT values after repeated testing, they would turn out to be negative. So for the numerous positive cases identified so far, we do find false positives from time to time. What about these false positive cases? Have these residents been discharged from hospital? What is the arrangement for them? The Hong Kong Infection Control Center would follow the referral made by would take on referral from the Center for Health Protection. So for preliminary positive cases involving residents in Kwai Chung Estate, they will be isolated together. And afterwards, if we receive an updated notice or correction from the Center for Health Protection, for example, if we receive news from the public laboratory, these patients will then be singled out for separate isolation. And then these patients will be referred back to the Center for Health Protection for follow-up. Next question, this gentleman.
CNN, I've got 3 questions for you today. The first question is about detecting untraceable cases in Hong Kong, because according to current government guidelines, people who test positive face spending weeks in quarantine or even having some of their pets surrendered. Are you concerned that strict quarantine measures may actually discourage people from getting tested in Hong Kong, and thus making it harder for Hong Kong authorities to detect untraceable cases? My second question is that whether you have an estimation on when the 5th wave can be brought under control. My third question is about the capacity of government quarantine centres, including at Penny's Bay. So can you tell us how full are they, and what is your contingency plan if they exceed the capacity? Thank you very much.
I think people in Hong Kong in general are very cooperative. According to what we observed, many people will get tested if they have contact with close contact of a confirmed case, or they have been to the high-risk places, and many of the cases were found this way. So I cannot predict when will the 5th wave be brought under control. We only try our best to isolate the cases and quarantine the close contacts to try to bring the cases down. For the health authority, I mean the health facilities, I'll leave it to the hospital authority colleague to reply. For the quarantine facilities, of course, we have a limited capacity for quarantine facilities, but we also have other alternatives such as home quarantine, etc. Of course, that may not be so ideal as quarantine facilities dedicated for close contacts.
Next question. This lady in the last row. I'm from Now TV. Good afternoon. The first question is whether you will assess the situation in Ha Kwai House, because in the morning some residents left the building. Would they present a risk of spreading the virus? And some residents have this following view, because for Yat Kwai House, residents have been trapped inside for 5 days, and if they continue to test negative, would you consider that the risk of cross-infection would increase if the lockdown is extended? How are you going to respond to residents' views? The other question is about the Discipline Services Quarters. Kwai Fok Court is in the middle of Kwai Chung Estate. Is it the first time we find a positive case in this building? There hasn't been any confirmed case before. So if there is an outbreak in the area, does it mean that this whole location is of very high risk, and then in the coming few days there will still be an increase in the number of cases in Kwai Chung Estate, and that the case numbers will not come down yet. How do you assess the risk in the area? And do you have the number of confirmed cases and preliminary positives for the respective buildings in Kwai Chung Estate? Can I have the breakdown? I mentioned for Kwai Chung Estate the relevant figures of preliminary positive cases and confirmed cases. As of 3 p.m. today, there are altogether 276 confirmed cases in Kwai Chung Estates. Many of these cases live in the same units. So for Yet Kwai House, 184. For unaffected units, 120. Ying Kwai, 64 confirmed cases and preliminary positive cases involving 43 units. Nga Kwai, 4 confirmed cases in 4 units. Ha Kwai, 13 confirmed cases in 5 units. Chin Kwai, 1 case. Yok Kwai, 2 in 2 units. Hill Kwai, 1 case. Choi Kwai, 2 cases in 2 units. Luk Kwai, 1 case. Bek Kwai, 1 case. Chun Kwai, 3 cases in 3 units. Park Kwai, 1 case. We need testing on consecutive days because of the incubation period. Even if you have a negative test report, it doesn't mean that the matter will come to a close. There is incubation, and that is why we need testing on consecutive days. And meanwhile, I would advise against going about, because once you get a negative test result, if you go out after a day or 2, you may turn out to be a positive case, and by then we'll have a lot of tracking to do to find close contacts. I understand for Kwai Fook Court, this is where it is situated, so it is included. Next question. Speaker's not coming through. We consider the movements of each case, and because they live in the same area, they use a lot of common facilities such as the wet market and the shopping mall, and everybody might have gone to the wet market or the market nearby or Kwai Chung Plaza. These places could be outside the estate, and there could be a transmission going on outside as well as inside the estate. Another question.
With some residents at Yat Kwai House complaining about the hygiene conditions there, how do you assess the risk of cross-infection within the building? And secondly, do you see any need for the government to lock down more blocks in Kwai Chung Estate or further extend their current lockdowns given the new cases? And also, thirdly, can you tell us a little bit more about the health conditions of the infected COVID patients in this 5th wave? What kind of symptoms do they generally suffer from, and do they generally suffer from less severe or milder symptoms compared to previous COVID patients? Thank you.
Of course, the hygiene condition is being taken care by the relevant government department. They try to improve the hygiene conditions as much as possible. And as for further lockdown or other measures, I understand the chief executive has announced this morning about the Ha Kwai building. So we'll closely observe the situation in other buildings in that estate and see what is more appropriate to do. For the health.
For the 5th wave, we observed that there was one case had serious condition, but he improved and then was discharged. And for the rest of the cases, all of them are stable cases.
The next one, the lady at the very back row. I'm from Oriental Daily. The case number 13338, 40-year-old male, which is an imported case. So where does he live? You mentioned about Kwai Chung Estate and the situation. For the preliminary positive cases, do they come from Chin Wan and Wong Tai Sin? There are over 100 cases every day, but today we are seeing less than 100 preliminary positive cases. Does it mean that we are lagging behind in our tracing down efforts? And then there is a case in Wong Tai Sin who bought a hamster in I Love Rabbit in early December. Does it mean that hamsters from a consignment prior to the 22nd of December has problems as well? Professor Yun said that there is no need to cull hamsters anymore. Is that going to be the case? And then for Ha Kwai House, when will you actually impose the lockdown today? Which case you are referring to? Is it today's case? 13338? That was yesterday's case, right? The person lives in Cho Yu Estate Kai Min House. For the whole genome sequencing analysis, it is still being done because this is just a confirmed case recently. And for the hamster case, we have to look at the results of the genome sequencing analysis. The person might have gone to other shops after visiting the pet shop, so we have to understand further before we can we know the situation better. Professor Yun Kwok Yung yesterday said that for cases detected much earlier, maybe the hamsters related have already recovered, but still we have to trace the patients who have been infected. Preliminary positive cases, I don't have the details. I know that many of them come from, are related to Yat Kwai House and Yin Kwai House. And some of the family members have been sent to quarantine center and they've tested positive. And for untraceable cases, investigation is still going on. And maybe I can tell you more tomorrow. Sorry, the speaker's not coming through. I think you have to wait for the announcement from the relevant authorities. I'm from Mingpao. And for the untraceable cases, for the accountant from Shanghai, did he return to Hong Kong through the Return to Hong Kong, Come to Hong Kong program? What kind of strain did he carry? Was it similar to local cases strain? And Dr. Chang referred to the 6th untraceable case, who is a lady. What kind of occupation is she in? And a question on Kwai Chung Estate. There are news saying that on Saturday and Sunday, some of the people who are later confirmed were actually waiting downstairs. Has there been cross-infection among the group? And residents said that there might be a risk of infection related to the testing arrangement. So is there a way to improve that? And from the public health perspective, what is your take on the possibility of cross-infection? And the situation on Wong Tai Sin, the Delta and Omicron variants have been detected in sewage samples in Wong Tai Sin. Which buildings were involved, and what is your take of the transmission chain in Wong Tai Sin? And for the case in Tropicana Gardens, living in Unit 5E, the person claimed that he bought the hamster. Can you tell me the results of the test for the hamster? When did the hamster arrive in Hong Kong? And after the person bought the hamster, did he go to other pet shops? And what is the genome sequencing of the patient concerned? The latest case is a 29-year-old lady who is a housewife. In Wong Tai Sin, we do see a transmission chain involving the Delta variant. there have been cases in the hair salon and also in Tropicana Gardens. For the case in Tropicana Gardens, that may be related to the hamster, but we can't tell for sure. We have to wait for the genome sequencing analysis. The FCCD has taken away the relevant hamster, and we'll have to wait for the results of the test. And for the person involved, we have to wait for the result of the test of the genome sequencing analysis for his virus. For preliminary positive cases, we don't require the persons involved to come down to take the test. And staff of the housing department have posted a lot of notices, and we would call up the preliminary positive cases and tell them to wait at home before we take them to the hospital. Sorry, the speaker is not coming through. It is a suspected Omicron case. He should have returned to Hong Kong through the Return to Hong Kong scheme. Well, the gentleman on the third row, from AM 7:30. For the part-time staff and the customer at the hair salon in Wong Tai Sin, how long did they stay? And what kind of what did they do in the hair salon? And for the Buddhist the Buddhist Fat Hall Memorial College, how many patients have been identified? And for the chef at Gold Coast, what is the case number? And apart from the changing room, what common facilities did the patients share? And for the cases in Kwai Chung, how many students have to be quarantined? And in yesterday's press conference, the person in 13324 has bought a hamster, and he had some contacts with 13367. So was he infected by the hamster or someone from the Kwai Chung estate? Now, people are trapped in the housing block because of the lockdown. Would you say that some of them have been infected because they have been asked to stay in their home? For the case in Gold Coast, it should be 13287 if my memory serves me right. You refer to we'll have to be looking at the results of the whole genome sequencing before we can ascertain the relationship between the two.
即係不斷地做檢測咧，就係會早啲揾到個個案啦嚇。咁當然做檢測嗰時都係要盡量留意嗰個社交距離啊，同埋嗰個感染個即係防感染嘅風險。咁居民一定要戴咗口罩啦嚇。
And residents should also make sure their masks are on and keep a social distance. For details, such as how long the case worked in the hair salon, we need further details. For the Buddhist Fat Hall Memorial School, I don't have further details at hand. It seems that there aren't new cases, but it is possible that the family members of these cases may get confirmed in the quarantine center. Next question. I'm from Point News. Yesterday, 2 confirmed cases donated blood. For the person donated blood in Shunwan, the platelets were transported to Eastern Hospital for use by another patient. What is the test result of this patient? And for these 2 donors, did they infect others? About the case I mentioned yesterday, a patient in Eastern Hospital received platelets from a blood donor. The test result comes back negative. And of course, we'll continue to monitor the patient's condition. As for the two blood donation centers, 26 colleagues have undergone testing, all tested negative. Next question, this lady over there.
CMP. Have the CHP identified the reasons behind the rapid spread of the virus at the Victory Avenue construction site? Does it have anything to do with, for example, the resting areas or poor ventilation, etc.? Second is Kwai Chung residents have complained that they've gotten infected while they were going down and waiting for testing. So can the situation be handled better? Is it possible for, testing to be done at their homes instead? And has the hospital authority noticed any differences in symptoms, transmission, incubation, etc. for the new Delta variant linked to hamsters with the D427G mutation? And lastly, are there any clues about the two untraceable cases, so the KG5 student and the 6-year-old boy who both live in Tongcheng? Because you mentioned that they both go downstairs to play at the podium. So are they linked at all? Thanks.
For the concerned construction site in Ho Man Tin is a residential complex known as Madeira Garden. So far, at least 9 cases have been detected. The building constructor and the developer are the Cheng Li Engineering Limited and the Hiep Sing Hong Development Company Limited. So the construction site involves a residential complex of around 29 floors with a total about 100 staff under the same subcontractor, and mostly are electric workers working at the ground floor and the first floor. So our investigation indicates that they work together and share same changing room and toilet. So because of the scale of the number of cases, all the workers will be considered as close contact and be quarantined. And the operator has to disinfect the place thoroughly before reopening.
The information on hand are all of the patients are stable. For further analysis of the symptoms differentiation, we may need to some more time to do some more analysis.
The 2 cases are still under investigation, and we'll need the whole genome sequencing to check whether, they do not know each other, but whether they walk around the same places, we need to check. I understand that the relevant government department is working on it.
If there are no other questions, let's take the last question on the 3rd row. I'm from Cable TV. Is it that even when you wear a mask, you get infected by Omicron? What about those staying indoors who are not wearing a mask? Would the CHP advise them to keep the mask on? And about the cases in Kwai Chung Estate, well, for preliminary positive cases, they need to stay home and wait to be taken to hospital. Will their treatment be delayed? And about Tropicana Gardens in Wong Tai Sin, on which day did the male patients seek medical attention? Did he get tested upon the advice of a doctor? Was the advice given? And about distributing rapid test kits to members of the public to get tested, why did you issue the reminder just now? Is it that for some who have tested positive, they still go out? I just want to remind everyone, because we received inquiry about positive results shown in a test kit. And about the resident, you mentioned he sought medical attention once or twice, but he did not get tested at the time. As for transmission indoors, the situation is more serious. For outdoor, the air circulation is better, and even if there is airborne transmission, It is not as likely to happen outdoors because of good circulation, whereas inside the ventilation is not as good, so transmission is more possible. So you should try not to have a conversation during meals, and should try to keep the time of taking the mask off as short as possible because of the high chance of getting infected indoors. So while staying indoors, if you just want to have a chat, please keep your mask on. Whilst at home, it may not be possible, but if you have any household members who are of high risk or who exhibit symptoms, please keep your mask on. The speaker is not coming through. I'm not going to comment on individual cases. Any other questions? Any other reporters would like to ask questions? If not, then that's the end of today's press briefing. The speaker is not coming through. Feng Wang San Chun, in Chinese it's called San Ying Zheng Hair Salon. The speaker is not coming through. Kwai Chung Estate, the total number of preliminary positive cases. How come you could count more cases than I can? Speaker is not coming through. Well, perhaps that's a different way of counting. Some may be close contacts. We have counted both preliminary positive cases and confirmed cases. Well, as of 3 p.m., the total stands at 276. That's the end of today's press briefing. Thank you. The speaker is not coming through. We will inquire the details. It's not a big salon, so I would appeal to members of the public who visited the place. It may not be easy to trace them down, so if anyone who has recently visited the salon, please get tested and please approach us, and we'll try our best to see if we could locate these customers. The speaker is not coming through. The reporter is not using a mic. I think that any place indoors would present a risk of transmission, especially Omicron is highly transmissible. So even if everybody wears a mask, if you stay indoors for a prolonged period of time, you may get infected. That's the feature of Omicron.